been called out to a 25-year-old female who sounds like she's just about to have a baby. So once we get to the scene, we'll just do a quick assessment for any possible hazards or dangers. We'll make sure the environment's suitable for having a baby in. Cool, so I'm now going to enter the scene. Hi, I'm Amelia from the ambulance. Can you tell me what's happened here today?
Oh, I think I'm having my baby.
Okay, so I'm just going to ask you a few more quick questions, and from there we're going to decide whether we take you to hospital to have this baby or whether we're having it here today.
Sounds good.
So, have you had a mucousy plug or anything come out?
Yeah, I had some mucus last night.
Okay, and have your waters broken?
Yeah, a couple of hours ago.
Okay, and what colour were your waters?
Like a yellowy sort of colour.
Okay, and are you feeling contractions?
Yeah.
And how far apart would you say they are?
Don't know, but they're getting closer together.
Would you say minutes or?
Yeah, minutes.
Okay, so Megan, I'm just going to get you to let me know every time you feel a contraction coming on, and I'm going to take note of how long that is lasting, and it's just a good indication of how close you are to having your baby for me.
Cool.
Do you feel the need to open your bowels?
Yeah, so I need to go for a poo.
Okay, and when was the last time you felt the baby move?
Like this morning.
Okay, so it sounds like we're going to be having the baby here, but I'm just going to ask a few more questions to make sure that there's no other complications, and if there isn't, then we're going to prepare for a birth.
Awesome.
So, is this your first baby, Megan?
It's my second.
Okay, and have you had any miscarriages, stillbirths, abortions, anything like that?
No, nothing.
Okay, so my patient has a gravity and priority score of 3 to 2. So, how many weeks are you, Megan?
39 weeks and 1 day.
Okay, and when is your due date?
14th of May.
Okay, and have you had any antenatal care?
Yeah.
Have you got hold of your midwife today?
Yeah, but he can't make it because he's at the pub.
Oh, that's not very good. So you've given her a
so-
call already?
Yeah, but said probably won't make it tonight.
Okay. So have you experienced other problems with your pregnancy?
No, everything's been good.
Okay, and any problems with your previous deliveries or births?
No, they were good as well.
And do you have any medical history?
No.
Not on any medications?
Nah, just taking some vitamins for the baby.
And have you created a birthing plan for this child?
Not really, I just plan to have it at home.
Okay. Now, Megan, how is your pain feeling at the moment?
It's pretty sore, like right now it's okay, but in contractions it's so bad.
Okay. So, I've got something I can give you, it's called methoxyfluoride. So this hasn't actually been tested on pregnant women, but there is no evidence suggesting that it does cause any problems. It's widely used in Australia for pregnant women. Do you want to take this?
Yep, give me the drugs.
Okay. So I just have to ask you a few questions. So do you have any allergies?
No.
Have you heard of anything called malignant hypothermia?
No.
Haven't seen this green whistle in the last week?
No.
And you don't have any kidney problems, do you?
No.
Okay. And I can see that my patient's able to obey commands. So I'm just going to quickly get my offsider to drug check this.
Methoxyfluoride 21.
Thank you, offsider. So Megan, I'm just going to give this to you and going to get you to take a big breath in and then breath out through the green whistle. It's really important that you use it like a whistle, so in and out, and that should make you feel a bit better. Begin preparing for the birth. My offsider has already set up the neonate resus gear, which is down here. We'll also make sure there's a suction handy and ready to go. We'll then consider the environment. We're going to heat it up as much as possible. So we've cranked up the heat pump. We've also got lots of dry towels and linen around. So, also going to keep an eye on my patient, make sure she's not hyperventilating or anything. Feeling alright there? Looks like the analgesia seems to be working. Also just going to try and get hold of the midwife again to maybe get a bit more of an idea what's going on. So I've left this up to my offsider to do. So Megan, do you have a preferred position to give birth in?
I hadn't really thought about it. Might swat a bit later.
Okay. So yeah, also just ensuring that we've got a clear space around the vagina to deliver the baby. While I'm also going to try and get some observations in between my patient's contractions, her heart rate and blood pressure in particular. I'm not going to be too worried if these are slightly elevated, as she is about to have a baby and she's in a lot of pain. Have you had any other recent checkups and haven't got any pieces of papers around from them, do you?
Yeah, they're on top of the fridge somewhere.
Okay, so I'm going to get my offsider to go have a look for them. I can use those to compare the observations to previous visits and also make sure there's no other information from the midwife. Megan, is it right if I take a look?
Yeah.
Okay, so I'm just going to have a little lift up. So I'm looking to see if there's anything unusual, see if the head's crowning or is visible in the birth canal. I'm also going to see if there's anything coming out that shouldn't be, such as an umbilical cord. If there is, immediately begin transporting the patient to hospital. I can see my patient looking like she's fully dilated at 10 centimetres, which is a further indication that the baby's going to be coming soon. I'm also, as the birth appears that it's going to be pretty soon, I'm just going to keep an eye on the vagina and be ready to assist any minute for the baby. Once she's actively birthing, I'm going to put some light pressure on the perineum to slow down the delivery and reduce tearing. So at this stage, I'm just going to get my offsider to head round to the patient's side and begin coaching her on the birth, coaching her on her breathing, and just help keeping her calm. The patient has also requested that we have some ACD playing throughout the birth just to help her get through it, so Tom is also in charge of this. So how are you feeling, Megan?
Oh, it's coming!
It's coming.
Okay, it appears so the baby's just crowning, so I'm just going to prepare. Put my hand on the perineum to help slow down the birth. Just going to catch it.
It's coming
Now that the baby has been born, I'm just going to wipe down the mouth and make sure there's nothing in there. If need be, I'll just quickly suction. Now I'm going to stimulate the baby. So I've got a nice loud cry, which is a very good sign. There we go, I'm just going to place it skin to skin on mum. And then I'm just going to keep baby warm. Got a nice clean blanket here. It's a beautiful little baby boy, isn't he? I'm also going to note down exactly what time the baby was born. And now I'm going to assess for an APGAR score. So I'm just going to have a look at the baby, assess its pulse, the grimace, appearance, and its respiratory effort. And then look out for any signs of distress. And I'm going to do this every 10 minutes. Just going to have a little listen on the back if that's alright. That sounds all good to me, nice and fast. There you go, you keep him nice and warm. So baby's crying, moving around. It's still got a little bit of a blue tint to him, but this is normal for babies that have just been born. If this doesn't go away within 10 minutes, I'll then become worried. So it looks like we've got an APGAR score of 9. So you've got a healthy little baby boy there. So I'm now just going to encourage mum to breastfeed. This will help the release of oxytocin and help stop the bleeding. So yeah, I'm just going to also have a quick look. Doesn't look like there's any tearing or any excessive bleeding. No signs of any hemorrhaging down there, so all good. So it's now been about 3 minutes since the birth, and it looks like the umbilical cord has stopped pulsating. So we're now going to clamp this. So Tom, can you please grab me the 2 clamps? And we're going to do this 10 to 15 centimetres away from the baby. And after that, we're just going to wait for the placenta to come out. For the purpose of this video, it's going to come out quite soon. So you ready to push again, Mum?
Yep, it is coming.
Okay, so you've got it, you've got this. There you go, so it looks like the placenta's come out. Now I'm just going to have a quick inspection. Doesn't look like it's missing any chunks. If it was, I'd take note of this. Yep, that looks all good to me. Mum, would you like to cut the cord?
Yeah, I would love to. Where am I going?
There you go, just in between those 2 clamps.
Awesome.
Cool. Now Tom, can you please put this in a biohazard bag and name it? So now I'm just going to make a plan for what I'm going to do with you and your little newborn beautiful boy, Megan.
Yeah, beautiful.
So, as there is no midwife here, I feel better about not leaving you at home with your baby because no one can keep an eye on you and continue your observations. If the midwife was here, it would be quite happy as that was a normal birth with no complications on leaving her here in the care of her midwife.